Welcome to the Education, Learning and Development Group Strategy 2021 to 2024. I would like to take this opportunity to introduce you to the RCN group members that are taking part in this work. We have the Royal College of Nursing offering both trade union and professional learning, education, advice and support for our members. The RCNI, which is our group publishing house, offering learning through RCNI Learning. And the RCN Foundation, the charitable arm of the group supporting nurses and nursing with grants and funding throughout their career. This strategy presents the first ever opportunity to address education, learning and development as a group offer for the UK.
The Royal College of Nursing Group is building upon its education, learning and development offer with a new 3-year group strategy. Education, learning and development can empower nurses, nursing associates, midwives and nursing support workers throughout their careers, developing and delivering evidence-based guidance and learning resources to support the UK's future healthcare workforce requirements. We know that CPD and lifelong learning contributes to safe and effective care and a skilled workforce, ensuring the development of individual team, organisation skills and knowledge. To provide high standards of care supporting the nursing workforce in lifelong flexible careers. The UK-wide RCN strategy will underpin the development of health and social care professions, giving access to flexible learning approaches, leading innovation, building on the integration of health and social care, and strengthening the voice of nursing and midwifery across the whole of the UK in all NHS independent health and social care settings. The group offers everything from bite-sized learning through to larger programmes that are accessible in a variety of different ways, online, face-to-face and blended. This strategy introduces 4 themes for your engagement. We want to explore how you feel we can support you to lead and influence patient outcomes. We want you to tell us your thoughts on what you feel would help you to strengthen nurse-led, evidence-based guidance for professional practice. Nursing is innovative, leading transformation of care through education, clinical practice and research. We want to know how we can support your lifelong learning as you progress through your career in this valuable profession. And finally, we want to ask you what access to learning you feel we can provide that will assist you to raise the voice of nursing to the very front of shaping the health and social care agenda. The Royal College of Nursing Group membership will lead the future direction, enabling us to develop this ELD strategy as one that is in motion and shaping future workforce requirements.
I'm going to take this opportunity to introduce you to the RCN Group vision. Our vision is to provide leadership and influence within health and social care through excellent quality education, learning and development, empowering nursing by providing evidence-based guidelines that support the UK future healthcare workforce requirements. During this webinar, I'll be referring to the nursing workforce, and it should be noted that the vision and strategy is for all members equally to consider. The nursing workforce refers to all members and groups: nurses, nursing midwives, nursing associates, nursing practitioners, nursing support workers, students, trainees and cadets of all ages from across the UK. I would like you to consider the following question. Does the RCN represent a desirable and achievable direction for the RCN Group professional and trade union provision of education, learning and development? Please use the form on the web pages and answer yes, no or partially, and consider as you fill this in, is there anything missing from this vision statement? Our strategy is a strategy in motion. Our ambition is to build upon the present strategic building blocks that we have within the RCN Group. These building blocks provide quality assured education, learning and development for all members. We will explore further the expansion of member and non-member access into our education, learning and development offer, and further empowerment of the nursing workforce, influencing the delivery of the UK and health and social care agenda. The rationale behind current initiatives of education programs, training courses and learning resources is often based on anecdotal information regarding where the greatest need is. The future ELD provision will be based on a demonstration of need, feasibility, sustainability, cost effectiveness and impact assessment, and this will be aligned to one or more of the criteria, such as considering what is our ambition. We can use a range of education, learning and development delivery models to achieve the following RCN agendas. To ensure that education contributes to the RCN safe and effective staffing agenda and supports the integration of health and social care agendas. That we support the national workforce plans for each of the four countries of the UK, and through continuing professional development and lifelong learning for nurses, support the delivery of these RCN agendas. In our consultation document on the web pages, you will find that there is a presentation of 4 main themes for your consideration. Our first theme is a nursing leadership to influence patient outcomes. We then consider education, learning and development for innovation and transformation, evidence-based guidance for professional practice, and our fourth theme, the voice of nursing to shape the health and social care. The present and future development of nursing leadership will support the development of skills, confidence and knowledge, influence and lead practice and policy development to influence patient outcomes. And the group will deliver evidence-based leadership education, learning and development that enables the future nursing leaders to develop emotional intelligence, self-awareness, resilience and confidence to effectively deliver and evaluate change and innovation. And to provide nurses and nursing workforce with education, learning and development pathways, providing skills, confidence and knowledge to influence and lead care delivery in a disciplined, systematic way, to positively influence patients' experiences and outcomes across the UK. And of course, to ensure the voice of nursing is at the forefront of practice and policy development and delivery. The RCN Group will aim to achieve this through supporting the nursing workforce with flexible approaches to CPD and lifelong learning across nursing and midwifery career frameworks, from cadets to executive nurses, and to provide recognised evidence-based skills, knowledge and competence to inclusive leadership programmes which influence patient outcomes and the delivery of the health and social care impact. Providing CPD and lifelong learning to enable members to influence, lead and evaluate the delivery of innovative healthcare at an individual, team and organisational level across all health and social care environments. And through providing CPD and lifelong learning, it will enable members to develop political awareness and confidence to challenge through this political advocacy. Therefore, I would like you to consider the following question and consider how you would like to see us deliver this. Question number 2. Do you agree the RCN Group should ensure the provision of evidence-based quality assured leadership, education, learning and development through providing resources to develop skills, knowledge and competence for all members of the nursing workforce? Yes, no or partially. Our second theme presents education, learning and development for innovation and transformation. The RCN Group will provide and deliver a diverse, inclusive and innovative approach to clinical education and learning programmes, which enables the equality of access for individuals and organisations' training needs, and deliver a flexible, practice-based knowledge skills framework to support and develop CPD and lifelong learning for all members to improve patient care and outcomes. And this will ensure the nursing workforce have the recognition of and access to flexible approaches to CPD and lifelong learning supported by a quality assured framework. Now we come to question 3. We aim to achieve this by the RCN Centre of Excellence providing evidence-based CPD and lifelong learning for nurses and nursing and opportunities across the nursing workforce. providing quality assured education, learning and development through our existing group offer, and working with stakeholders to develop accessible and flexible approaches to CPD with easily accessible online platforms for clinical and best practice guidance. Please could you consider the following question. Do you agree that the RCN Group should ensure the provision of evidence-based education, learning and development to positively influence patient experience and outcomes? Yes, no, or partially. And please go to the online form and consider telling us how you feel we can best achieve this. Our third theme for your consideration is the underpinning of professional practice with evidence-based guidance. The RCN Group will increase the recognition of the RCN as an organisation leading nurses and nursing with education, learning and development which is underpinned with research and evidence-based guidance, providing the public with continued confidence in nurses and nursing's delivery of safe and effective care. We aim to develop a learning and development offer that builds the evidence base for future delivery of care, embedding research, which will provide an indicator for individual and organisational quality. And develop nurse-led best evidence-based guidance, providing recognition of the knowledge and skills acquired by nurses and nursing to improve patient care and outcomes. And providing best evidence-based guidance to ensure continuous improvement in the quality of care delivery and outcomes for patients. The RCN Group aim to achieve this through the development of a Centre of Excellence for Education, Learning and Development, which will provide leadership and the development of research and evidence-based guidance for nurses and nursing. By providing nurse-led evidence-based guidance, it may provide a measurable framework for quality assurance in the delivery of patient care and the measurement of outcomes and impacts. By ensuring there are learning resources for members to develop research skills, and learning resources for members to develop evidence-based practice resources. Our existing group offer will work with stakeholders and develop research and evidence-based guidance leading care improvements and delivery. Please consider the question number 4. Do you agree that the RCN Group should be the organisational leading nursing workforce with resources and underpinned by research and evidence-based guidance, providing the public with continued confidence in nurses and nursing delivery of safe and effective care? Yes, no, or partially. Please use the online form to tell us how we can do this. And our fourth theme aims to raise the voice of nursing to shape the health and social care agenda. The RCN Group Education, Learning and Development will empower nurses and nursing to lead the delivery of the health and social care through enhanced effectiveness of practice and innovation. By providing education and learning which will enable the nursing and midwifery workforce to influence the delivery of health and social care. Providing learning and development through the gaining of skills which empowers the future workforce to respond immediately to areas of concern, seeking the resolution for and by members and colleagues. And to provide education, learning and development that is empowering for the workforce to lead organisational change, influencing the political and professional leadership. Our fifth question. The RCN Group aim to achieve this through the development of the Centre of Excellence and to ensure that the providing of education for learning and development offer supports the future workforce to feel competent and confident and empowered, working with the stakeholders, developing evidence-based guidance that will support and direct organisational change, and developing team learning opportunities in organisational settings, national speciality forums. And through the development of education, learning and development opportunities, there is a potential to provide the opportunity to gain academic credits. Please consider question number 5. Do you agree that the RCN Group Education, Learning and Development offer should empower nurses and nursing to lead the delivery of health and social care through enhanced effectiveness of practice and innovation? Yes, no, or Consultation question number 6. The RCN have a quality assurance system in place for the development of any of its resources for nursing workforce. It also provides quality assurance framework for endorsing and accrediting externally produced resources. Please consider, is it important that the RCN quality assures education, learning and development for the following: members, the wider sector, and/or international? Please go to the form on the web pages and answer yes, no, or partially. Consultation question number 7. Would you be prepared to pay additional fees for education, learning and development access from the RCN group, which could include modules of clinical learning, bite-sized clinical learning, access to up-to-date evidence through an app, or an up-to-date flexible online delivery platform, for example, a YouTube channel? Please consider informing us of any or all of the above that you feel would be applicable. Question number 8. Please take a moment to consider, would academic credits be beneficial for the following areas of education, learning and development? And let us know all that apply. Large clinical modules, short bite-sized learning resources, online resources, and practice-based learning. Please expand your answers and explain why. Question number 9. The RCN is committed to providing education to its members and to the wider health and social care workforce. Please tell us how the RCN group can ensure that the learning and development is accessible and impacts positively on all of these groups. Question number 10. The RCN group would like to know how you currently access RCN group learning and development. Is it through any of the following? Please indicate on the form any of these or all of these. RCN website, the RCNI website, the RCNI journals, through Google, through other search engines, through the RCN Reps Hub, face-to-face sessions, or conferences and events. I'd like to take this moment to thank you for your valuable time and thoughts. We value the views that you're sharing with us, and should you wish to reflect upon this webinar and these questions, please feel free to visit the web pages to re-listen and also to access the online form sending us your views. Further comments can be added until the 30th of September 2020, and through the completion of the engagement form, they will be taken into account through the RCN webpage. Or perhaps you wish to send us an email on the following address: rcneldstrategy@rcn.org.uk. Please take time to complete the form with your reflections, and don't forget that this session can be used as part of your revalidation for your CPD. Your comments will present us with some common areas for discussion, so please feel free to send these through to us in any of the appropriate platforms. Thank you for listening.